I'd like to welcome Dr. Suzette Clements. Welcome.
Thank you.
She is founder of Flat Shoals Foot and Ankle Center, located in Decatur, Georgia. And a little difference about you, Dr. Clements, you have a holistic approach
Absolutely.
to podiatry.
Yes.
I find that very interesting. Tell us a little bit about it.
Well, I follow the motto of functional medicine. Functional medicine looks at, it's the new medicine, which looks at the root cause of the disease process. Often we treat symptoms. With that motto of treating symptoms, typically we're not getting to the root cause. Functional medicine looks at the root cause of the disease process. When you successfully treat the root cause, the symptoms go away.
So, give me an example. What about, I'm sure diabetics come to your office quite often, right?
Absolutely. We are a diabetes center of excellence, so we see a ton of diabetic patients. A lot of times, most people don't know that majority of disease processes, whether it's heart disease or diabetes, are caused by inflammation. One of the #1 things that causes inflammation is stress. Stress will cause over 90% of the disease processes. So if you're able to help, when you look at the patient as a whole person, you don't just see them as a foot that walks in the door, but you actually look at them and you think, what are the things in their life that could be causing their blood sugar to go up? So it's not just giving them insulin, it's not just, popping another pill. Maybe they're having a life crisis that's going on. So we actually will speak with our patients. I even go as far as if they need prayer and they ask me for prayer, guess what? We pray together.
Wow, so you take it that extra step.
We have
This looks
to.
like it is the whole body.
It
Do you think this is a
absolutely-
new approach in medicine?
It actually is an old approach. This is, I like to think of myself as the Marcus Welby for podiatry. And before we used to use MRIs and those things,
Right.
we actually used to examine the patient and we looked to see what were the things that were going on. We talk about the family. We'd say, hey, how's your mom doing? Or in the South we say, how your mom and them?
Right.
But we looked at the things that surrounded that patient as an individual and say, well, you know what, maybe their sugar is up because of the crisis they're going through because their mom just died. You see what I'm saying?
That's right.
Your body does not know that you're diabetic in a crisis. In a crisis, your liver is actually producing glucose. It's called gluconeogenesis. But what happens in that crisis situation, your body increases the glucose production, which raises the blood sugar level. So you see what I'm saying?
So just basic stress
Yes.
can help you can make you create bad habits or unhealthy habits,
Exactly.
which can impact any part of your body.
Any part of your body, because yes, absolutely.
So as a podiatrist, getting back down to the feet,
Yes.
I know that women, it's going to be really hard for you to tell us,
Right,
give up our heels. So what would you talk to people like myself who like to wear heels?
Right. Well, I encourage women to wear their heels.
Okay.
Quite honestly.
Well,
Now,
we like that.
there's moderation in anything, correct?
Definitely.
So what I say is, because it's very difficult to tell a woman that she can't wear that pump that just makes her feel like a woman. That's normal. However, we say, make the appropriate shoe choice for the appropriate activity.
Okay.
If you're gonna walk 7 miles, be in a good cross trainer. If you're gonna run, be in a running shoe. If you're gonna do a lot of specific activity, make sure you have the shoe for the activity. And we do a lot of foot gear training in our profession.
Okay.
We actually teach patients what type of shoe to be wearing. For instance, I have a lot of patients who have a very narrow heel and a wide forefoot.
Right.
That type of a combination is very difficult to get in a shoe comfortably because they're actually using these muscles up here. So I teach them, this is the type of shoe for your foot type. These are modifications that we need to do within the shoe to get you to be comfortable. So there's actually a science to having comfortable shoes that are functioning for your foot.
So are you saying that I don't have to wait until I have some kind of foot problem in order to visit a podiatrist and ask them to take a look at my gait, the way I walk, how I walk in my heels, and if it is the right fit shoe for me?
Absolutely. We prefer that you're proactive versus reactive. What do we mean by that? You don't have to wait until you have a strain, sprain, or fracture. a lot of times women, as they age, some men, mostly women, because of osteoporosis or thinning of the bones, they'll start exercising because they go to their primary doctors who are helping them and say, hey, you need to start walking or running to lose weight, correct? As a result of them running, that repetitive micro trauma of just the foot hitting the ground
Right.
can cause stress fractures. But if you come before you start that exercise routine, and we tell you your foot type, the balancing things that you need to do, the proper shoe type or shoe gear for your foot deformity if you have one,
Yeah.
then we're being proactive. Make
Okay.
sense?
Makes sense. So what's the difference between like a walking shoe
Mhm.
and a running shoe? I don't see the difference.
Oh, there's a tremendous difference. It's almost like saying what's the difference between a tire for a car and a Jeep. It's made, some of them have what we call lasts, which is the outside of the shoe. They may have more rigid material on the outside versus the inside, more flexibility, where flexibility is needed under the balls of the foot, but there's a huge difference.
So when we do purchase shoes for our particular activity,
Mhm.
I need to make sure that I'm running, what is the type shoe?
Yes.
I'm walking,
Yes.
what is the type shoe?
Absolutely.
I
A
see.
lot of mistakes are made. For instance, someone will be in a flip-flop and they're thinking, oh, this is comfortable because it's flat. No, it's probably one of the most damaging shoes because as your arch flattens, which is called pronation, it actually locks the big toe joint and can cause a lot of arthritis in the joint.
Is that right?
It causes something called hallux limitus. The hallux is the great toe. It limits the joint, and if you think all of your weight has to go through those two big toe joints, so we see a lot of damage to those joints. And a simple thing as placing an orthotic, which is a device that goes in the shoe to balance the foot, a simple thing as placing an orthotic can actually decrease or limit or totally stop the progression of arthritis in the feet. And not just the feet, also in the knees.
Right,
Because
it's
with the
weight bearing.
balance, exactly. Because what happens as the arch is falling, if we don't have the proper motion here,
Mhm.
we're gonna lose it in the upper extremity also.
I see. I myself, put the paper up, I can't remember. The other paper that I was gonna ask her a question. So you said orthotics. Okay, there, all right. Dr. Suzette, there are different types of shoes now. The new type of shoe that has like a tone up, that has a rock and you rock. What do you recommend? What do you say about that type of shoe?
We have used those shoes for years, but we
Oh.
typically use them for a diabetic patient that needs to offload the forefoot or get the weight off the forefoot. I personally do not recommend them because they change your gait, they change how you're walking, and it's allowing you to use other muscle groups that you normally would not use for walking. So it may be okay to exercise in them, but I see people walking all around the store in them. I don't think that's a
Yeah, and
healthy
they
thing.
encourage it. The inserts actually encourage that you do that. They even have flip-flops like that. Now they
Right,
encourage you to walk. I actually was speaking with a massage therapist and she was totally against those types because she said that in the back of the heel that it was either shortening it or elongating it.
Well,
Is
what
that-
I think what they're talking about is with Achilles tendonitis. The Achilles
Okay.
tendon is that long tendon in the back of the foot.
Right.
What happens, for instance, with a high heel shoe or a woman who wears a high heel all the time, that becomes shortened. So as she tries to wear a flat shoe, she actually gets small tears or irritation or inflammation or shortening of the Achilles tendon. So when she tries to wear a flat, she's unable to. So she ends up with a lot of chronic pain. So these are things that we teach patients to do. If you're gonna wear your heel, we teach stretching exercises, we teach things to do so you continue to use your feet in a pain-free manner. Because remember again, my motto is foot pain is not normal.
Foot pain is not
It's
normal.
not normal, and at Flat Shoals Foot and Ankle Center, we diagnose and treat to keep people on their feet.
Well, I appreciate it. Can you give us one more tip? Can you leave us with a tip?
The best tip is that we have a very perfect balance, but over time, that balance is distorted. It can be our arches fall, they typically will fall as we age, as we gain weight. So instead of thinking you'll never be comfortable again, people override that pain, that warning sign.
Right.
I want to say, no, you need to get it evaluated, just as if your car light came on.
Right.
You wouldn't just throw your car away.
Right.
Some people think that foot pain is just a passage of life and they continue in it. But it can be treated successfully, but they need to have professional advice so that condition can be evaluated, diagnosed, and treated 100%.
So we don't necessarily have to wait for foot pain.
No.
We can go to see a podiatrist before we have the pain. Many of the podiatrists are having a holistic approach to it. They are treating the whole body. I'll be looking forward. I will be visiting Dr. Clements really soon. I want to thank you very much for joining us today. I hope you were inspired, and I hope you were able to make a head-heart connection. You have a good day. We'll see you next time.